Good afternoon, and thank you for joining us. As we close 2025, we are looking to ensure that we start the new year on a healthy note. Today's webinar covered California health coverage and changes in times of changes, what Latino entrepreneurs need to know. We will meet Covered California representatives. Our speakers this afternoon are Adam Unger, Senior Manager, Sales and Product Development at Covered California for Small Businesses, and he'll provide kind of like the big picture overview of what the program is all about. And our second speaker is Roberto Ortiz, agency owner for Covered California Plans, who will share how to sign up and be able to answer any questions you may have. The webinar will help you understand your health coverage options, navigate changes like taxes and credits and benefits, and learn about financial help and get the expert Q&A session that will make enrolling easier and ensure that you pick the best program that's more affordable for your needs, whether it's for yourself, your family, or small business. Today's session is a convenient way for you to gather all information and to get clarity on complex healthcare issues and rules from the experts. The session is being recorded. We will have a second session for those of you who would like to hear this program once again, and that's slated for Friday, December 12th at 10 a.m. So stay tuned. But in the meantime, sorry, I'm trying to get over a code. But in the meantime, please mute yourselves, write questions in the chat box, and they'll be addressed at the end. After the webinar, we'll be joined by Amor Vittel from Delta Airlines, who will share some perks about the airlines for your business, and I'll share upcoming events. So stay tuned to the end. And at this point, I'd like to welcome both gentlemen to the program. So, Adam, please begin. The floor is yours.
Yep. Olivia, thank you. And thank you to the Chamber for the invitation to provide some updates on Covered California at today's webinar. Welcome all attendees. I'm joining you from chilly Sacramento. So we were just commenting before the webinar started. I really wish I could be down there in sunny Southern California and joining you guys in person, but this webinar format will have to suffice. Livia gave a little bit of an introduction, but just a tiny bit more about me personally. I have been with Covered California for roughly 9 years, a mixture of work on our individual exchange. And so that is the exchange that I feel like most folks are kind of intimately familiar with. We provide an avenue and a structure for the delivery of subsidies that come from the federal government. About 2 million people enrolled on that exchange. And then for the last 4.5 years or so, I've worked on Covered California for Small Business, which is a smaller exchange, of course, providing a structure for the delivery of federal subsidies to small business owners, those with less than 100 employees. So I've got a good mixture of experience. I've worked with brokers up and down the state, business owners, entrepreneurs, individuals and families up and down the state, delivering Covered California. Our mission just to reduce the uninsured rate, make sure that folks are enrolled in coverage that benefits their families, them individually, and protection for their business as well. Again, for the last 9 years or so. So with that, if we could just kind of transition over to my first slide, and we'll hit it one more time. Yeah, next slide. Perfect. So as I mentioned, and just hopefully this is just a reinforcement of what you might already be familiar with, but Covered California is really kind of split into two. We operate as one single body, a state agency, but there are two different exchanges within the organization. Covered California, again, that's specifically for individuals and families that don't otherwise have access to health insurance. So a large percentage of the population, fair amount, receive some level of employer-sponsored benefit. And if that benefit is deemed affordable, they enroll through that employer. But then we have the great entrepreneurs of the state, and then individuals and their families that don't have access to that employer-sponsored coverage. They don't qualify for Medi-Cal. They don't have any VA type of benefits. And really the landing place for those folks in the individual exchange is Covered California. So, we provide an exchange that allows for financial assistance to be applied for individuals and families dependent on their specific financial circumstances, where they're located within the state, and kind of what plan availability there is for those folks. And then conversely, on the other side of the exchange, and what I work currently a little closer with is Covered California for Small Business. So that is intended for small business owners that have anywhere from 1 to 100 W-2 employees. And we provide a smaller offering in terms of total health plans, but a really good value proposition and a very kind of streamlined structure for small business owners that are either familiar with already offering benefits to their employees or are new to the space of offering employer-sponsored coverage. It's just a very kind of simplistic and kind of plug and play type exchange that we have. And so again, very, very happy to have worked with Covered California and kind of support both of these exchanges and see the thousands, tens of thousands, millions of Californians that have benefited from the program. Next slide. Okay, so I'm going to start on the individual exchange and just kind of walk through the mechanics and the structure of how the individual exchange operates and then transition into small group. So we will start with the 11 health plans that Covered California as an exchange offers. Regionally based. Every Californian has at least 2 plan options, so 2 of those health plans to choose from. 95% of Californians have 3 or more plan options regionally based on where they live, and 75% of Californians have 3 or more. So you see, some very recognizable names down there in Southern California. There's a great mixture of traditional HMOs like a Kaiser Permanente, LA Care. And then some larger PPO type players, both in Anthem Blue Cross as well as Blue Shield, and really a good mixture of kind of statewide participation at the carrier level, but then also very regional, kind of niche plans as well. Aside from the health plans, there are 5 dental plans that are offered through Covered California. If you are an individual enrolling and you have dependents, those dependents are going to have embedded dental care in the health plan that you're purchasing. But if you don't have dependents or you'd like to purchase kind of supplemental dental coverage for yourself, there are those 5 dental plans to choose from. Next slide. Okay, so who is eligible for Covered California? I think that the biggest thing I want to highlight is a large percentage, 25% of our enrollees are sole proprietors. As I mentioned, Covered California is a landing place most often for folks that just don't have access to alternate forms of employer-sponsored coverage. So we've got a lot of sole proprietors. 50% of our total membership is associated either as an owner of a business or somebody who's working for a small business. Maybe you work for an employer and the company size is small and there's no offer of that benefit. There's no requirement for the employer to offer insurance. And so as an alternative, we enroll those folks that are working for those small business employers. Eligibility, which I'll get into in the next slide, is really dependent on household income, the number of folks that you have in your house. But to be eligible to enroll with Covered California, there's just some basic requirements. You must be a resident of California. You need, kind of permanent residency status or be lawfully present in the state. You must be under the age of 65 with some minor exceptions. Potentially you're eligible for Medi-Cal and also enrolled in, Covered California. There could be, or pardon me, not eligible for Medicaid. There could be instances where you're above 65 and also enrolled, but those are limited. So generally those below 65 prior to them transitioning over to Medicare. And then to be eligible for financial assistance, I will get into those specific criteria here on the next slide. Okay, so you can enroll with Covered California with or without financial assistance. About 95% of our enrollees currently do benefit from some form of financial assistance. And so I will walk you through just the basic mechanics of how that works. Pardon me. The table here is a little small. It's hard to see the figures, but this is referred to as our federal poverty level chart. So, again, depending on your household income and the number of folks that are going to be enrolling within that household, that's going to kind of give you a percentage of where you are on what we call the federal poverty level chart. And based on that percentage, that is then applied to kind of a specific baseline plan or a benchmark plan within your region. And from that, this, kind of somewhat complex calculation, we determine how much financial assistance or subsidy you are eligible for based on that criteria. And it's kind of based on the price of plans in your region. But then again, the biggest anchors are your household income. This slide, pardon me. I did want to pause and just discuss eligibility kind of within our current landscape and the offer of financial assistance and subsidy that is presently available in 2025 and will be expiring in 2026. So I am sure that there are those on the call that are enrolled in some form of individual coverage, potentially on exchange. And more than likely, within the last couple months, few weeks here, you've seen a renewal notice where it is showing that your financial assistance and ultimately your monthly premium has increased fairly significantly. Based on the expiration of enhanced premium tax credits that were approved and then ultimately implemented in 2025 as a result of the American Rescue Plan, those tax credits are set to expire at the end of 2025. They will not be continuing in 2026, and absent of any congressional action, what you are seeing in your renewal notice, pardon me, is a reduction in that financial assistance just based on those enhanced tax credits going away. We are expecting some type of congressional vote in the days to come. Whether that's going to be introducing some other form of financial assistance, potentially in the way of funding health savings accounts, or a continuation of the existing enhanced premium tax credits that are set to expire, that is to be determined. It is really, anybody's guess as to what that congressional action will ultimately result in. But I think we do need to operate under the assumption for now that the premium assistance that's being applied to current premiums and what you're seeing in that renewal notice will be what you will pay, ultimately for 2026, again, absent of any congressional action. And so what does that look like kind of on the macro level? Again, 9 out of 10 covered California enrollees have some form of financial assistance that's applied on a monthly basis. And so on average, if we look at the roughly 2 million or so folks enrolled in covered California, they're going to see their monthly premium increase on average 97%. And so in dollars, that looks like about 125 extra dollars per enrollee. Again, it really depends on your household income, where you fall kind of within that bracket, the number of dependents that you have within that household. But a really key factor is the expiration of that financial assistance means that folks that were over a certain income threshold, that as a result of the American Rescue Plan saw some assistance that previously they didn't have, that is going away entirely. So, their assistance will be reduced to zero, and they'll be paying, net premium based on what the carrier is charging. And so a few different actions, that can be taken. It's important, and it's a very individual decision to be made, whether you want to renew into the existing plan that you have. Can you shoulder that additional burden of that financial cost? Or ultimately, do you need to go in and take a look at potentially looking at an alternate plan? It could be a different plan with the same carrier. It could be the same level of coverage, but you're moving to a less expensive carrier. That's another option. Or again, just ultimately renewing into what you have. And so these are very individual type conversations to have, within your family or for you individually. And so that kind of leads me into my next slide. So we have, for those that are not familiar, a tool on the Covered CA website called Shop and Compare. And so I went through what can seem like kind of a complex calculation for determining what your financial assistance is. We make that very, very easy for you, and we have a tool that does the calculation on your behalf. So you can go in, you can put your estimated in household income for the upcoming year, the number of dependents that you have, your zip code, so we're going to pick plans based on your region. And what you're presented with ultimately is this shopping feature that allows you to say, hey, I'm interested in LA Care plans, or I'm interested in Blue Shield plans, and these are the various levels of coverage that I want to take a look at. And ultimately, we will give you what your net premium is with the application of what potential, subsidy that you would be afforded. So really good tool. Just encourage either if you are looking to enroll on exchange, just become kind of familiar with the shop and compare tool, or if you're renewing and you want to look at alternate plan options, great resource as well. And then I'm going to be joined in a couple slides here by one of our vetted longtime insurance agents down in the Southern California region. And I always just advocate and really recommend if you need any assistance understanding what is this? What does an LA Care network look like? What access do I have in terms of doctors and hospitals? Always encourage you to reach out to a vetted insurance agent. They are skilled and they speak this lingo, and they can really, I think, translate health insurance, which is often complex, translate it into just very tangible, kind of actionable, insights. Next slide. Okay, so open enrollment, again, we're on the individual exchange here. So open enrollment began November 1st and runs through January 31st. Very important, if you want your plan to start on the first of the year, so January 31st, you need to have made the plan selection by December 31st. So if you are on the fence, again, encourage you to work with our shop and compare tool, understand what your coverage options are. But this is the time to enroll. If you do not ultimately enroll by January 31st, you're ineligible to enroll unless you experience, and this is that second section here, a qualifying life event. And so our special enrollment period is going to run the rest of the calendar year, but you have to experience either a loss of coverage through your employer, you got married, you had a baby, you moved from Southern California to Northern California, and now you have access to these different plans. So there's a list of the majority of qualifying life events here. We also have a page within the Covered CA website that details in a little bit more granularity these qualifying life events, and there's the addition of a few as well. But just really encourage you, if you are on the fence about purchasing health insurance for this year, you don't expect to experience one of those events, you have a finite window to enroll for 2026, and that's going to be here before January 31st. Next slide. Okay, so now I'm going to transition over into Covered California for small business. Next slide. Okay, so CCSB coverage. I mentioned on our individual exchange, we have those 11 health plans. With Covered California Small Business, we have 3 health plans and 1 dental plan. So Kaiser and Blue Shield are going to be, fairly statewide plans. You have access to those 2 carriers in most regions of the state. And then Sharp Health is just going to be down in San Diego. We have, pardon me, HMO plan through Kaiser, HMO and PPO plans available through Blue Shield, and then the great HMO plan in Sharp. And then Delta Dental, very similar to the way the individual exchange runs. If you have dependent children, they're going to be offered kind of embedded dental coverage. But if you want to purchase, supplemental coverage through our exchange, through CCSB, that would be done through Delta Dental. There are, in comparison to the individual exchange, Covered California for small business covers about 9,000 businesses throughout the state. And that totals about 80,000 in total membership, including the employees and their dependents, business owners. So a little bit smaller in scale. But again, we provide a very good kind of value proposition in that you have really good plan selection, and it's fairly easy from an administrative standpoint to work with CCSB. And I can get through some of kind of the details of how that works here in the next few slides. So go to the next slide. Okay, so who is eligible for CCSB? CCSB is only for employers that have at least one, but no more than 100 eligible employees. And so, this is not for the sole proprietor or small business owner that doesn't have any W-2 employees, or even a business owner who has a spouse or family member, but you don't ultimately have anybody that's W-2. Specifically, that is kind of the primary criteria. And then there's certain contribution requirements An employer that enrolls with us needs to contribute a minimum of 50% of the cost of their employee's premium. And so that's 50% of the lowest cost available plan to the employee. And there's a certain period within the year where they can contribute less than that. But for the majority of months, that is a core requirement for enrollment. And ultimately, as I'll get to in a couple other slides, to be eligible for any federal tax credit, small business tax credit, you need to meet that contribution requirement as well. Uh, Majority of your eligible employees need to live in California, although through Blue Shield, we have access to the Blue Shield Blue Card, which has national reciprocity. So if you are a small business owner and you are located in Los Angeles, but you have employees in Colorado, Texas, we can ultimately enroll and cover those employees through the Blue Shield card as well. So that's part of our value proposition as well. Next slide. Okay, so again, who's not eligible for CCSB? When you're doing that maximum 100 count for full-time equivalents, we're not contributing towards, or we're not factoring in anybody that's working less than 20 hours. So those employees are actually not eligible for Covered California coverage. Nobody receiving a 1099, seasonal or temporary employers or employees rather, and then your sole proprietors. So again, just simply looking at those W-2 employees that are eligible to enroll through your small business. Next slide. Okay, so I went through, there's kind of two elements of participation and contribution. I mentioned that 50%. So that is the employer contributing 50% of the employee's premium amount. Second kind of eligibility factor is you have to have 70% of the employees that are within your small business either enrolled through CCSB or enrolled through another form of coverage. So that could be, they could be enrolled in Medi-Cal, Medicare, VA coverage. And when we're doing a calculation on the percentage of participation within your group, at least 70% of those folks need to be enrolled, again, in some form of valid coverage. So I left the details on this slide, rather minimal, but, within our website, it'll give you a full list of what we deem to be eligible coverage. And ultimately, if you enroll with us and you're submitting your paperwork, we would need to obviously see those that are enrolling with us, but then valid waivers, some proof of valid coverage provided for those employees that have coverage elsewhere. Not necessarily articulated on this slide, but just kind of the mechanics of how Covered California for small business works. As an employer, I am going to come in and I'm going to select a reference plan. So you've got the various metal tiers, bronze all the way through platinum. And I may say, okay, I'm going to set my contribution at the gold Kaiser plan. And so you set fit, and I can choose anywhere from 50 to 100% contribution for my employees. There's no requirement or minimum kind of contribution requirement for the dependents, but I could ultimately opt to contribute towards the dependents as well. So I'm making that decision. I'm choosing what my reference plan is. And then from the calculation of whatever 50% of Adam's premium for that Gold Kaiser plan is as the employee, Adam takes that money, it's a finite amount of money, and I can go and I can select up in plan at the individual employee level. I can say, hey, I don't necessarily want Kaiser. Maybe I need a Blue Shield Platinum plan. That's going to be more expensive, but I'm able to apply the kind of financial contribution of my employer towards that higher cost plan. Or conversely, I can say, I don't really need the gold plan, but I like Kaiser. I'm going to go in and I'm going to select a Kaiser bronze plan. And I'm bringing my premium down because I'm applying, a gold level contribution towards a bronze level purchase. So, hopefully that makes sense. Those are kind of the main factors ultimately in an employer's decision. And then what we do is, say you've got 15 employees and some are enrolling in Sharp down in San Diego, some are enrolling with Kaiser, some are enrolling with Blue Shield. We go in and we aggregate all that premium and just give you one single bill each month. So you're not paying invoices to these different carriers. It's all enrollment on one platform, one consolidated bill, splitting out, what's due from the employer, what's due from the employee into just one kind of aggregated monthly premium or monthly invoice rather. Next slide. Okay, and last but not least, tax credit through CCSB. So to be eligible for a financial tax credit, the employer it needs to be a business size of 25 full-time equivalents or below. So, main kind of eligibility factor there. And then secondarily, of all of those employees, excluding the business owner, and family members included in the business, they need to have an average wage of $65,000 or less. And assuming that's the case, and there's just a tiny, tiny typo I didn't correct here, but again, that employer needs to have contributed at least 50% towards the cost of the employee's premium. And if all of those criteria are met, the small business can apply through the IRS for a tax credit that basically will cover for 2 years, 2 consecutive years, 50% of the cost that they're contributing towards employee premium. So, for those that kind of meet this criteria, smaller employers, relatively lower wage earners, they can benefit for 2 years of this tax credit. It's exclusively available through Cover California for small business. So you'd have to enroll through CCSB to benefit ultimately from this credit. And with that, I know a lot of information. I was going through it very quickly. I'm going to hand it over to Roberto Ortiz, who is, again, one of our vetted insurance agents, and he's going to walk through kind of the mechanics of how enrollment works, what documentation you need, how you can benefit from working with a broker. And then I believe we'll take some questions here at the end. Take it away, Roberto.
Hi, everyone. Can you hear me? Yeah, okay. Hi, everyone. My name is Roberto Ortiz, and I'm a broker working already for 15 years, working with Cover California for the last 12 years since the first enrollment. And I'm work with California Plans, which is our agency. It's based on Pomona, California, Southern California, but we help individuals, families, and business in the entire state. So it doesn't matter where you are in California, we can help you. Before I jump to this, thank you for being here. Thank you for inviting us. This is a very important information, guys, since all these changes are happening. I think this information is very valuable for us as an individual or as a business owners. Now, jumping into this, the information that we pretty much needed, we need you to have a payroll. Okay, if you have a corporation, LLC, S Corp, a C Corp, anything that you have a payroll, and you need we need the DEC-9, which is pretty much a payroll, in order to fill up the applications for the employer, for the employees, and the information has to be related to the payroll. Now, sometimes it's needed some other information, and this happens when the address from the payroll is different than the address of the business, but it's just clarification than we need. As Adam say, we need at least one employee to be on the payroll besides the owner in order to qualify for the small business. Next slide. So, why should I offer health insurance? It's important because when good employees are looking to work in a company, one of the questions is like, do you guys offer benefits? So that's something that can help you to retain the good talent, the good employees. Offering insurances help you with the balance in the lives, not only for them, sometimes for their families. Boost your productivity because they have access to the medical networks, and they can return to work faster in case then they get sick, they get injured or something. And also financial security, because it's about physical care, like people, you offering a care for them, they should come to you and offer a care for your business. So it's you give, they give you something in return. which is in this case, you offer the insurance, it's a benefit for them. If you offer it for the family, it's as well for the family, but it's something that you can attract it makes more attractive to your business as far as an employer. Next slide. Now, one of the reasons that we are here to help you guys as a brokers or as a certified insurance agents, it's free. It doesn't cost you anything, our help. We're here to help you to explain all the plans, pretty much what Adam said, but a little slower. And so we go hand to hand with you and explain you everything, explain you all the plans, explain you all the benefits, not only in the business side as far as a small business, also as an individual. If you have questions on the individual and you don't know what to do, you don't know what plan to select, you don't know the networks, you don't know which plan is more affordable to you, more that fits more your needs, that's what we are here as an agent. We help to maximize your savings, which means to choose the plan that is more affordable for you and that fits your needs as far as health wise. If you have a disease, you have a sickness, you have some special need as far as health wise, we can recommend you, suggest you which plans will be better for you in each situation. So that's what our expertise, like networks, companies, it depends where you live is the network that we access. We can review your medications, we can review everything. And as far as small groups, we can help you to decide which plan will be better for you, depending where you are. As an Adam say, if your business is located in California, but your employees are outside, we can help you to select the plan that it will give you that coverage for your employees. Ongoing support and advocacy, we help you to make the payments are coming direct to you, but we help you to set everything. You have any questions, you got a letter that you don't know how to read, you can call us. So we are open year round, and we are a bridge between you and Cover California. So that's our job. That's what we do. We help to save time because we have the expertise already, and we take the stress for you. We just explain you everything and give you all the directions to collect the paperwork, help you to fill the applications, everything, either individual or group. So make your life easier. And we are open year round, and we are here to help you. We work hand to hand with Cover California. So that's why we're here, to help you to live a stress life from all this that is happening right now in the medical field. Next slide. I think that's the last one. Yeah. So I think at this point we will take questions if anybody has questions.
Hi, it's Olivia again. So let me go through here. There was one from Omar. Has CCSB been available before this year? I'm a small business with 2 W-2 employees. I am puzzled as how this is the first time I've heard of this. I guess it's never too late to start. Are the rates comparable with the regular covered California? Thank you.
Yeah, thank you for the question. Yeah, CCSB has been around as long as the individual exchange has. As I mentioned, we are a much smaller exchange than the individual, and so admittedly, a lot of the marketing that you see throughout California is rooted in the individual exchange. We've got just kind of less of a footprint really within CCSB. So I'm glad that you're hearing from us. It's unfortunate that it's the first time. That kind of falls within my camp, so we'll do a better job. But to answer your question, group rates within the group market tend to be in California a little bit less than individual. You have a little bit more plans to choose from ultimately. I mean, Covered California for Small Business has kind of one portfolio, but just the market more broadly, there's a little bit more plan selection, and rates tend to be a little bit lower. So, whether, ultimately, whether you want to check out Covered California for Small Business directly or just look at the individual exchange, I do think that there's some good plan options either direction.
Okay. The next question is, what is the range of percentage paid to agents by the medical, dental, vision plan providers?
Uh, yeah, so I can answer that. As Roberto alluded to, Covered California does not pay agents directly on the individual exchange. Within CCSB, we do more or less operate as the carrier. So one of our responsibilities is to pay the agents as if we were Kaiser or Blue Shield. So percentages vary. I will say to support an individual exchange enrollment, if you work with Roberto, it is in the low single digits that Roberto would be compensated based on your premium amount, whether it's a fixed dollar or a percentage of what you're paying in premium. But it is relatively low, lower than the national average, I would say. And then with CCSB to support an exchange enrollment, again, single digits, which is industry standard. It does not matter whether you're enrolling directly with Kaiser or through CCSB. Industry standard, low single digits for compensation to the insurance agent. Again, that we've done various studies, and I would just say personally, I don't feel like the compensation is egregious by any means. I think that it duly compensates them, appropriately compensates them for the work that they're doing, not only enrolling you initially, but supporting you through accessing care and understanding the network design that you enrolled in, and just ongoing support throughout the kind of the course of your enrollment.
If I may add something on that comment, maybe it doesn't make a change if you go direct with Core California or we help you. The price is the same. I mean, it doesn't change anything. So it's pretty much kind of like a support for you, and more than nothing. I mean, it's like same thing. Like there's no price variation on your end. It's the same price.
Yep.
Okay. Next question from Carla Garcia. If you don't qualify for any tax premium credits, should you just go directly to the insurance carrier to purchase a plan?
Roberto, I don't know if you don't want to take that.
I take that one. You can go directly to the carrier, and it's pretty much going to be the same plan. I mean, it's going to be the same plans, same cost. It doesn't change the plans, the costs a lot. I mean, outside of the exchange, there's some different plans that the exchange has, but the prices are the same. So either you go to Cover California or you go out of the exchange, the prices should be the same price. It's just outside there is a more range of plans. Let's say in Cover California, let's say Blue Shield has 4 plans, and Silver outside they might have 6, but the prices is the same. Doesn't change like in or out of the exchange.
Okay. Question is also, if we get quotes from various brokers, are the medical, dental, vision costs to the employer the same or slightly different based on the percentage charged by the broker? I don't think the broker fee has anything to do with the cost. I think
No.
it's a
Once
misconception.
more. The us, we don't have nothing to do with the price. I mean, it's nothing to do on when you're paying that is affect you. What we help you is does nothing to do. Imagine that you go and get an ice cream, and the prices are behind you, whatever, and I'm serving you the ice cream, and doesn't mean that if I'm gonna serve you, I'm gonna charge you like 20 cents more. No, the price is already there, and that's it. We're just helping you to fill all the applications, the forms, and direct you which plan is better for you because we know the networks, and that's the difference.
So based on the conversation we're having, it's best to go to a broker like yourself who you can have a relationship with, build
Exactly.
a bond, and you're able to tailor the program, the cost, or not the cost, but tailor a program that benefits a family or a business, correct? Because
Exactly. It's
now
like
instead of going to a computer and adding all going online and adding all these features, you're now having someone who can guide you step by step
exactly.
is able to answer the questions as they arise, correct?
Yeah, it's like if you go to the compare tool, I mean, you can compare yourself and you can apply yourself, but there's some questions over there than you need to have kind of like the basic knowledge to answer. And for us, because we've been doing this forever, uh, we already know. So we just ask you the right question and we can direct you through it. I mean, it's not like if you ask over there or you ask over here. I mean, it's like we're there to help you. And we have Cover California key to backs up, then we are here to help you.
Mm. Yeah, I know when I tried doing it myself, I got overwhelmed and flustered because I kept getting people calling me and it wasn't the same person. So, it wasn't the right time. I'm in a meeting. They called during the day and for me, working during the day was not the right time because I'm on the clock or so to speak, right? But when there's an agent or a broker who I can speak with who has evening hours and they're able to dedicate that they're able to help me on a one by one as opposed to someone who doesn't really know me. So, how many covered California agents or brokers are within Southern California? Because I know this program is reaching not just LA County, but surrounding communities.
Yeah, in LA alone, there are hundreds of insurance agents. I will plug Roberto again. I've worked with Roberto for a long time. He is one of our vetted agents down there. We have storefronts that are kind of branded as Covered California. Your average person wouldn't know the difference. You're going in and you're working with somebody who is an extension of us. We have very close relationships with. A very large percentage of our enrollees, both on the individual side and in CCSB, work with an insurance agent. It's really a benefit to them to do so. And I think outcomes in so many different avenues are increased and just really improved when you're working with an agent that knows what they're doing.
Plus, we open the entire year round, and we have a good team to answer the calls, reply emails, request documentation, and everything that Cover California tell you to do or help you to read letters, anything. Once we work together, we have access to all your accounts, and we can start checking if something goes south, and we can help you to get it in line.
Okay. The next question. I'll be retiring as of January 1st, 2026, so in a couple weeks. I can't afford to keep my medical insurance. Is there a number I can call to get more information?
Well, are you, when you say retire, are you turning 65 or you just retiring from your job? If you're retiring from your job, you can give us a call, and I think the phone number is going to be posted anyways on my email, but I'm going to give it to you. Actually, I'm going to put it over here in the chat. Uh,
Perfect.
there you go. Okay, that's our office phone number. You can call us and be more specific what you mean by you're going to be retiring. If you're going to retire 65 and you're going to turn to Medicare, or you're just going to retire from work and you're going to be without work for a while. So it's two different things and we need to find out about it. But you can call us and give us a little more detail, and we definitely can direct you to the best option and help you. I'm going to post also my email.
Yeah, and that was the next question. Is it possible to share the contact for both Adam and Roberto? So we'll be
That,
sending you
that's
a
that's also my email.
thank you email, a link to the webinar, as well as the deck that was presented. So along with their email and contact, so that way you'll have it readily available. And once again, Roberto will be on the call, Friday's call, along with another rep from Covered California, since Adam has another previous engagement and can't join us then. But we're still going to get a lot of great info. And let me see, there's a couple more questions. So Roberto, you put in your phone number as 909-623-5050. So if you can take a note of that or take a quick picture so that way you have it readily available. And
And like I said, we cover the entire California. Doesn't matter. I saw one of the questions says in Moreno Valley. We cover Moreno Valley. We cover San Francisco. We cover Sacramento. We cover Los Angeles. We cover San Diego, San Bernardino, all the entire state. So
so,
you can
so
call us.
your,
We can
your
help you
office
for the entire state.
bilingual, multilingual.
We
Um,
are bilingual,
mhm.
English, Spanish.
Okay.
So we can help you in either or.
All right, perfect. And then from Stephanie Glover, I'm a small business owner, but limited income. Would I be able to qualify for anything?
If you're a W-2, I mean you have a payroll, we might look your business and see if you have at least one employee that can help you to get the group insurance. Uh, if you don't have an employee, then we can help you to go individual as well, depending on your situation for your business. But you can call us or send me an email, and so we can go a little more on depth and definitely tell you which one way is better for you.
Now, I have a quick question. I know, and this was a question that I brought up before we came on live. So, if there's no coverage for yourself or employees, is there a fine or a penalty? Can you provide, I guess that would be an Adam question, more information on this? So, I work at a company, but they don't have health insurance for me. Who pays the fine? Do I pay the fine? Does my employer pay the fine? How does
Yeah.
that work?
Yeah. So, pardon me. The employer, based on their size, there's going to be a responsibility for them to pay, and it needs to be affordable coverage. And if they don't meet those guidelines, the employer would be on the hook. And so, on the individual side, you need to have health insurance. There's a requirement. There's a mandate in the state of California, which differs a little bit from nationally. And so ultimately, when you're filing your taxes, you're going to submit proof of, kind of continuous coverage throughout the course of the year. And if there's 90 days or so with no coverage, you do have to ultimately pay a penalty, which for an individual is $900 and, just, $450 or so for each dependent. And so, if your decision is, hey, I'm just going to go without, I'm going to pay this penalty, important to kind of keep into consideration what that penalty is going to be.
Mm.
You could, in essence, elect a plan and be enrolled and pay, a few $100s more than you ultimately would if you're just going to go without and pay that penalty. So just again, all individual and kind of personal decisions to make, but important to know that so you're not kind of caught off guard at tax time.
And that's a penalty for the year, correct?
That's correct. Yeah.
Okay. And
Um, Go
so
ahead.
we're talking to small businesses. So, in some cases, there's business owners who may not be able to afford it. So it's easier to just pay the penalty. But, are those folks who are not covered because it's a small business of 3 or 4 employees? What are their recourse? Can they go apply for a program such as Covered California on their own? But then again, it's going to be based on their income, correct?
Yeah, so your smaller employers, if the threshold is just escaping me, 25 or 50, Roberto, correct me if I'm, but you need to be kind of within that employee count to be, kind of on the hook really and have a responsibility for payment. Your smaller employers, 10, 15, even 20 W-2 employees, there's no requirement for you to supply them with health insurance. So ultimately, you can encourage them to go seek enrollment through the individual exchange, depending on their income. I mean, they're not receiving any coverage from their employer. So based on their income, they could be eligible for subsidy. I think what we just want to be careful of is if you do have a small employer, 5 or 6 employees, but they are offering health insurance and that insurance is affordable, their employees cannot go to Cover California and get subsidy. They're ineligible for the subsidy because they're already getting affordable coverage through the employer. And so that's important. As long as the employer is providing coverage that is not on a monthly basis, 9.6% of that individual's income, then that coverage is deemed affordable, and they need to take that coverage, or they can enroll with Covered California, but without any subsidy, no financial assistance.
Yeah, one thing that I must add to the Adam's comment is if you have a business and you pay the insurance for your employees, that's a expense for the business. So that's an important thing. And if you pay Cover California on your own, that comes out of your pocket. So it's different because if you have a group insurance or small business insurance, that's going to come from their business. So that's another thing. I mean, it's an expense coming from the business, not coming from your pocket.
Okay. There was someone who wrote a question, but they took it off, and I kind of got to read a little bit. Um, they work in California, but I guess headquarters is somewhere out of state, but they pay a lot of insurance. So can they, if the company is outside of California, but you're an employee in California, I'm assuming a W-2, can you apply for Covered California, or do you have to take the company, say the company's in Texas, right? So you're Texas based, but office in California. Do you have to get the insurance from the employer? Can you still apply for Covered California because you're in a different state?
If your the cost of your insurance is more than 9.6%, then you can apply in Cover California.
Okay.
And I think that's the next question. Doesn't it,
Yeah, so the next question,
it does include the
at
kind of things of,
9.6%, does that
no,
include high deductibles, out-of-pocket potential?
no, that's just the cost of the insurance.
Yeah.
All right. Next
Mm.
person. I retired from the University of California with my 24 years of service, and I am 50 years of age because my commute is so far. I get it. So I am not on Medicare. So they're not eligible for Medicare. The goal is to get another full-time job near home, but if I can't get a full-time job, would I qualify for coverage?
Yes, you qualify. We need to see your annual income, but if you're not getting income at the moment, you might qualify for medical. Depending on the money that you're gonna make a year. Let's say you start working like right now. Uh, One of the questions in the application is what is your annual income? And that's the base of how much you will pay. But if you at the moment are not working, not getting income, then you might get medical.
Make sure that you do follow the law, get coverage if you can. And then we're hoping that, in the next couple of weeks, things will be resolved. And maybe there's another plan that can benefit us all. But for now, thank you, Adam and Ricardo, for a great presentation. And
If I might add something
yes,
real
please.
quick, just think about her case and see how important it is to have insurance.
Mhm.
So insurance is, I mean, I know that it's expensive, but you buy insurance for your car, you buy insurance for your home,
Mhm.
and those are replaceable. Your health sometimes is not replaceable. So it's very important to have medical insurance. Doesn't matter where you get it, but it's important because if something happened to you and you're the caregiver for your family, what's your family going to do? You stop working because you have an illness. Plus, all the medical bills and everything is going to accumulate. So, I mean, if you was insure materialistic things, why not going to insure yourself?
Correct.
Yeah, that's the value of medical insurance.
And that's a good way to end today's segment.